Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Welcome to video number 2 in our hip pain series to kind of teach you a little bit about your hip, things you can do at home to diagnose it. And then our third video is going to go through things you can actually do at home to treat it. So if you're here, you've watched our first video, kind of went through some of the anatomy of the hip, what different issues you could be having. And now you're on video 2, which is we're going to go through a couple of different tests you can do at home to determine exactly what's going on at your hip. So thank you again for joining us on our series of talks. If you have any questions at any time, you can post a comment below or respond to the email that you possibly received that you got this video in, and we'll be sure to answer your questions. Also, we have offered a free phone consultation. So if you want to know more about your hip pain, if you have some questions, even asking after this video, you can certainly reply on our email to get a free phone consultation and have one of our doctors of physical therapy give you a call. So hip pain. Hip pain is, as I was just talking to one of my colleagues, our most popular blog on our site where we get thousands of hits every month is the hernia versus the groin strain. A lot of questions about that. We're going to go through today kind of how you decipher, because it is one of the reasons people have hip pain. Is this referred pain from a hernia or is it a groin strain? Difficulty with the hip is that it connects basically the upper body to, or I'm sorry, the lower body to the leg. So you got your leg, your hip here, and your low back. So sometimes pain at the back can be referred to the hip. It's not really hip pain at all. It's actually coming from the back. So we have to kind of decipher, just like with any other joint, what's going on and where that pain is coming from. So a lot of times with pain in the hip, you know, we hear a lot about a pain in the butt. You know, that is a referral pain coming from the hip. So we're going to go through a few things today that are going to show you what you can do at home. Now, the first thing we're going to go through is the labral tear test. Now, hip labral tears are not all that common, but they do occur. Now, unlike shoulder and things like that, hip labral tears, unless you're a professional athlete, very rarely do they get repaired. They're starting to become a little bit more in the forefront of being repaired, but generally, anything that's going on with the hip labral tear, we can, you know, decrease the symptoms. We can get you back to doing everything we can through some hands-on therapy, through some exercises. So it's not one of those things where if you do this test and you find that there might be a possible tear, that you would need to run to the doctor right away or freak out because you think you're going to need surgery. Very little cases of hip labral tears result in surgery, and very little hip labral tears after manual therapy and after some exercises result in full function and pain-free. So the biggest thing with a hip labral tear is you're going to get some clicking. Clicking can happen at any time throughout the walking cycle, the running cycle, when you go to sit down. But a lot of people who have a labral tear will notice some clicks. So we're going to kind of go through what we call a scour test. This is a little bit more challenging to perform on your own, only because if you're not relaxed or you're not getting good joint surface congruency, if it's not coming together right at the joint, you're going to get some false negatives, or false positives. But what you're going to do is you're basically going to move your joint around just like that, and you can use your own hand to do it, just like Sam, our lovely assistant, is doing. So she's just moving the hip around in the joint. Now, if you have someone there that can do this for you, you can have them lay down, and they can take your leg, and basically you just want to roll that hip around the entire range of motion that it can go. You're looking for a click. You're looking for not necessarily pain, because in that position, there's other issues that could be going on that can cause pain. So it doesn't necessarily indicate a labral tear. If you have pain, you're looking more for a click. You're looking more for almost a ridge that you jump over, something along those lines. But that's going to be indicative of a hip labral tear. Like I said, again, those are not very common, but they do exist, so we wanted to point them out to you. The next one is the hernia versus the groin strain. So this is a huge issue for people. Why we see a lot of people is because they don't know. This is a difficult one without sort of having any imaging to diagnose because hernias can refer pain. So, but one of the easiest ways that we kind of rule it in or out right off the bat is if you go into standing, what you're going to do is you're going to palpate your adductor muscle, okay? So you're going to take your fingers and go right in on your groin, okay? Now you can do this in standing, you can do this in sitting. The idea is that you are relaxed. And what you want to do is you just want to go up and down that muscle. Pretty, not too hard. I would say apply moderate pressure. If you push really hard, you're going to get a positive anyway. It's going to hurt. But I would just go up and down this muscle, and I would just see, does it hurt? If there is a groin strain, that is going to light up. Like you're going to push on that, and it's going to be very painful. You're going to find a spot in there that's painful. And a lot of times with a groin strain, people say, it hurts right here. Push on that spot. Does it hurt when you push on that spot? The answer is yes. You're most likely looking at a groin strain. You're looking at some muscle involvement. If the answer is like, no, I push there and I mean, I feel the pressure from my fingers, but not really painful, nothing too bad, you're most likely looking at a hernia. Now, you can sometimes feel a hernia if you come up and you go on the inside of the muscle or of the bone in your hip that juts out, and you kind of slide your fingers right in on that bone. Now, this is really difficult because if you are not relaxed 100%, your stomach muscles are going to kick out your fingers, so you won't necessarily be able to feel it. But that is probably one of the easiest ways to begin to decipher whether there's a hernia or whether it's a groin strain, is the fact that if you push down here and it lights up or you have pain, usually a groin strain. Now you can have both. Some people have ignored a hernia long enough that there's been compensation issues going on. So even they'll push on this and it will be very painful. The thing about a hernia is if this is hurting and it's a referred pain from the hernia and you just got the hernia, you won't feel anything when you push on this. You won't feel anything when you go up and down. There's not going to be a point of tenderness. All right? So again, with this test, you want to be relaxed. You want to make sure that you're in a relaxed position. The final test you can do at home to see if there's a hip issue is you want to do this one in sitting. All right? And all you're going to do is compare one side to the other. So you're just going to cross your ankle over your knee. Now, ideally, this goes flat. So Sam's got a little bit of hip tightness going on. She's a runner. We can expect that. So there's things we can do to loosen that up. The most important thing with this, though, is we compare sides. Sam's obviously got some dysfunction going on based on how difficult it was to put this hip up on this knee as compared to the other side, which a lot of you will notice. One side will go up very easily. One side will struggle to get up. You'll need to use your hands. Some of you won't be able to do it. That's an indication that there is a hip issue going on. There's muscle imbalances. So you also want to look for the height of the knee. Ideally, it's flat. Some people are all the way up here, okay? Some people can't even get into this position. If that applies to you, that's a big indication that, yeah, there's a hip issue going on. Now, at that point, there are a lot of things that it spirals into on, is this something we need to really address? But the answer is yes, you have to address it. This type of pattern only gets worse, Okay, so if this is what you're noticing, and you're here, obviously, because you have some questions about hip pain, that's an indication of a problem. That's an indication of something that needs to be addressed. So really pay attention. The sooner you can address those things, the better. I know we're all pressed for time. I get it. I have 3 small children myself. I run my business. I don't sleep very much, so I get no time. However, spending time when you find the problem is exponentially less than if you let this go. So now, while this may be a few home exercises, watching the next video and showing you how to release the hip a little bit will help, will help you. If you put this off and if you ignore it, you're looking at months and months of medical intervention and lots of money, okay? So finding things and dealing with them right off the bat, certainly the way to go. So thank you for tuning in to our second video. Look for the third in a couple days to come, where we're going to show you some things you can do at home to actually treat some of these hip issues.